Hello everyone. Today I'm going to talk about antibody-dependent cellular cytotoxicity, ADCC. In this presentation, I'll cover 4 key points: what ADCC is, the immune cells involved, the examples of how it works, and clinical applications. Let's begin. ADCC is a process where immune cells destroy target cells, such as cancer or parasite-infected cells, with the help of antibodies. Here's how it works. Antibodies, mainly IgG, bind to specific antigens on the target cell. The Fc region of the antibody interacts with Fc receptors on immune cells, like NK cells or macrophages. Once activated, these immune cells release cytotoxic substances or perform phagocytosis, which leads to the destruction of the target cell. Now let's look at the immune cells involved in ADCC and the roles they play. Natural killer cells are the primary players. They bind to antibodies, and once activated, they release cytotoxic granules like peripherin and granzymes, which lead to apoptosis in the target cell. Macrophages use their Fc receptors to recognize antibody-coated cells. They engulf and digest these cells in a process called phagocytosis and release inflammatory molecules to enhance the immune response. Eosinophils specialize in dealing with parasites. They use IgE antibodies to recognize and damage the parasite surface. Let's move on to examples of ADCC in action. Type 2 allergic reaction. In this type of reaction, antibodies bind to antigens on cell surfaces or linked molecules. This activates immune cells too much. As a result, cells and tissues may be damaged. In parasitic infections, IgE antibodies bind to antigens on the parasite. Eosinophils then release toxic granules to attack and destroy the parasite. Now let's discuss the clinical applications of ADCC. In tumor immunotherapy, ADCC is a critical mechanism in several monoclonal antibody therapies targeting CD20, HER2, or CD38. For example, daratumumab is a monoclonal antibody that targets CD38, a protein on multiple myeloma cells. Here's how it works. Daratumumab binds to CD38 on the myeloma cell surface. NK cells recognize daratumumab through their Fc receptors. NK cells release toxic substances like peripherin and granzymes. These substances destroy the myeloma cells by causing cell death. These therapies work by ADCC to eliminate tumor cells. Their high specificity minimizes damage to normal cells, making them highly effective and safer than traditional treatments. ADCC is also used to manage autoimmune diseases by targeting disease-causing immune cells. For example, this targets CD20 on B cells. These therapies focus on the harmful immune cells while minimizing side effects, preserving the patient's overall immune function.